morning, everyone. Welcome in on this Friday. I'm Jessica Lovell, in for Dr. Steve Stites. He'll be gone for a couple days, but he'll be back next week. Don't worry, so you're kind of stuck with me today. Sorry, but you do have Amanda Cackler because it's Friday and she's in today. She is our Quality and Safety Director. How are you?
Good morning. I'm doing well. Good. It's a little cold outside, but hopefully good weather coming this
No kidding.
Weekend. I think it might rain, though.
Yeah.
We'll see.
I know. But like I said, it's Friday, and we're all really happy, in a good mood. Dr. Dana Hawkinson, how are you?
I'm good.
All right. What are our numbers overnight?
You know, numbers are still pretty good. We have under 10 acute infections. So we have 9 acute infections, but 4 in the ICU. I think we had 2 yesterday. 3 of those, 75%, are on the ventilator. So that's not good. So it's pretty critical illness there. Still 18 in that recovery period, so 27 total patients. Hays is holding steady. 4 total patients, 2 active infections, and 2 in that recovery period. So hopefully we can either stay steady or decrease through the weekend for those acute infections.
All right. Thanks for the update. Okay, so I'm going to be sitting here asking questions. You guys are going to do all the work, which I really like. First, let's ask if there's any reporter questions out there today. Nada. Okay, so Jill Chadwick is on the line. Good morning. How are you?
I'm good. Happy Friday, everyone.
Yeah, no kidding, right? Okay, so any questions that are coming through from our viewers watching right now?
I do have one this morning, and it's kind of an interesting question. There was a person who got the first shot of Moderna vaccine 4 weeks ago, and they were due for their second shot, but they had a bad reaction, she said, possibly allergic, and her endocrinologist advised against her getting the second shot. Her heart rate and her blood pressure spiked, and this went on for 4 days. So now she wants to know, would it be a good or a bad idea to go ahead and get maybe the Johnson & Johnson vaccine, even though she's only had 1 dose of Moderna?
Yeah, I think the kind of the simple answer to that is no. I would still go ahead and get Moderna. I would talk with a primary care physician, and or if you have an allergist, you can always be referred to an allergist. But I think, you know, those types of reactions, we have seen those as well in the past. Maybe not the blood pressure issues that you've been discussing, but we know that people can still have significant reactions after that second vaccine. But my initial answer is going to be no. I would go ahead and stick with Moderna and get Moderna. You know, obviously you can do that 15 or 1/2 hour monitoring time after the dose for any immediate effects. But overall, I think you're still going to have, you know, pretty good safety for being able to get Moderna and not really have any true health risks by getting that second dose of Moderna.
And Kendra, she said, I had moderate eye pain when moving my eyes. Shortly after the shot, it lasted about 24 hours. Is that a side effect? Have you heard of that before?
I haven't seen anything like that before. It's good to know that it resolved within 24 hours, and it's really hard to know, was that related to the vaccine, or was it something that was potentially happening, and it just was coincidental as far as the timing goes. But I haven't seen anything specific to that.
Yeah, you know, where was the eye pain? What was the description of it? Did it affect your vision at all? You know, those are questions we'd want to ask, but I haven't heard specifically of that, and you know, don't know if it's been reported. I'm sure other people have had those types of symptoms, but again, I think to Amanda's point, you know, it's good that it was transient. We know that people do get some transient different effects as well.
Okay, and we're continuing to get a lot of questions, but I'll just do one more for right now, and then, Jess, you can check back in with me if you want. Betsy from Topeka wants to know about the J&J vaccine. She's supposed to get it on April 17th, and she's nervous because she's heard about reactions that people have had in North Carolina and Colorado. She says she has Addison's disease. She wants to know, what do you think? Do I get it?
Yes.
Yeah, I mean, again, I think the short, simple answer is yes, I would get it. I don't know what kind of reactions she's heard about in Colorado and North Carolina. I'm kind of ignorant of that at this point. But I haven't heard or seen any evidence of true safety concerns from the Johnson & Johnson vaccine. We know that a lot of media outlets are certainly quick to report those types of things. We saw that with some of the blood clotting issues from AstraZeneca. We also saw that with all the pauses that occurred during those trials, but I haven't seen that specifically, so otherwise I can't speak on the details of that. But I would still say, if you have a chance to get this vaccine, go ahead and get it.
Yeah, I think the underlying message that we've been saying all along is that the side effects are way less severe than if you were to actually get COVID. So don't let the potential side effects of the vaccine get in the way of getting the vaccine.
All right, Jill, we'll check back in with you here in just a few minutes. So our first of our follow-up Friday questions is, if I am taking tamoxifen, which has the risk of causing blood clots, which vaccine is the safest for me to get?
Any vaccine?
Yeah, a lot of the safety concerns we've heard about are due to the AstraZeneca vaccine, and particularly with that VIPIT, that vaccine-induced prothrombotic state that potentially causes blood clots, although very rare in certain demographics, especially younger age groups, from what we've seen. But we haven't really seen any significant safety concerns or signals for Moderna, Pfizer, or Johnson & Johnson at this point. So I would say go ahead and get anyone.
So I know, and you've talked about this a lot, but really it's not, there's really no risk of any. Just if you can get it, get it. But if you had a choice of three, it doesn't matter. Just get what you can get.
If you have the choice and all three are available, I would probably go with the Johnson & Johnson just because it's the one dose.
Yeah.
But ultimately, if you have access to any of them, get any of them.
Yeah, I think it's what's important for you. I do have some friends who are waiting for Johnson & Johnson because it's one dose, because they perceive as some of the initial reported side effects as maybe lower percentages, because then they don't have to go back and get a second dose, potentially getting other side effects. If you have concerns, moral concerns, obviously we've seen what the U.S. Conference of Catholic Bishops has said about production of Johnson & Johnson versus some of the mRNA vaccines. So I think it's depending, where are you making your decision based on? Is it just due to one dose and maybe potentially decreased chance of side effects, maybe with Johnson & Johnson? Is it due to moral concerns? I think it all goes with what you are basing your decision on, but any of these vaccines are going to help protect you significantly against hospitalization, severe disease, and death.
If the vaccines make us 90% protected, what is the 10% risk? Is it risk of death, risk of long-term side effects?
Mm-hmm. Yeah, again, I think we have to understand how are we determining vaccine efficacy. The major ways of determining vaccine efficacy in those studies was with severe disease and death. They also have vaccine efficacy rates for getting asymptomatic infection. That means getting the disease but not having any symptoms whatsoever. And we've seen very good numbers for that, depending on what vaccine you're looking at. But also symptomatic infection. So that is, if you do get exposed, you get the disease, you have symptoms. We've also seen a reduction in that as well. So I think it just depends, what are you asking the question about? But most of all, what we continue to talk about and been most consistent about is the significant reduction or the efficacy and protection against hospitalization, severe disease, and death for really all of these vaccines.
All right, what about children going back to school? Would you recommend holding them back? Is it safe? Amanda, I know that Blue Valley and Olathe, their parents are already going to town talking about this. Should they, hold back on the mask mandate, things like that? What are your thoughts if you had to kind of look ahead 3-4 months from now? What are you thinking?
Yeah, I think that there's been well demonstrated now the ability to go back to school. I think it's critically important that we still have the infection prevention measures in place, and we're still monitoring what that community transmission rate is. We know that the transmission in the classroom activities is actually fairly low. It's a controlled environment. You can control the spacing. All the students and teachers are masked. Now we know more teachers have the ability to get vaccines, so that's good. I certainly wouldn't hold back a student from going back to school. I think there's probably more long-term effects of that decision versus going to school. And again, we have been able to demonstrate that you can be in a school setting and be safe.
And kids are doing it right. I mean, that's the one population that you don't have to fight with on it.
In the classroom,
Yeah.
yes. I think we have seen transmission happen outside of the classroom, in other gatherings and that sort of thing. But school, I think, can be done very safely.
Yeah, I agree. I think it can be, but again, it's not one measure. It is important, and we continue to see information about this. We see very good published studies how schools can be safe, but it's because they are doing multiple things, and that includes masking. That includes the distance. We know that it's hard to get distance in those classrooms because of just so many people in there. So at first, it was 6 feet. Now it's been reduced to 3 feet. There's even some dissenting opinions about that as well. But again, it's not just one thing. It is the masking. It is the distancing as much as possible. It is engineering, such as good airflow in the rooms also. So it's a combination of those things, and it goes back to that Swiss cheese model that we've seen. But again, also one other thing to help and add to that, to keep our adults in those schools healthy so they can continue to work, it is certainly vaccination of all those teachers and all those other certified professionals there in that school.
And I think it's really important to mention that they have not said, and you can do this without masks
Correct.
on. Everything is still
Yeah.
with masking, social distancing, good hand hygiene, stay home if you're sick. If community transmission rates are high, really thinking about those cohorting considerations, testing, quarantine, still all of those things are critically important.
And plan on it for this fall. most
Absolutely,
likely.
yeah.
All right, so how long does it take for the FDA to fully approve the Pfizer, Moderna, and J&J vaccines? What has to happen for them to be taken off the emergency use authorization and be considered fully approved?
Yeah, I think that would be a great question for Dr. Alt, our vaccine expert who is on the one of the groups that helps okay these vaccines for the FDA. But really what we're looking at, again, remember the first vaccine to be fully approved, it took 4 years. I believe that was the measles vaccine. So this has gone certainly at warp speed, as we have heard and seen, obviously, by the moniker. But what they are going to continue to look at is the safety. So it's the reporting of these adverse events. And it will be continuing to look at the efficacy. I would say actually full approval probably may be within the next 1 to 2 years, which again would still make it the quickest vaccine ever to come to market and be fully approved. But so far what we've seen is the safety profile for these currently emergency use authorized vaccines is very good.
What do you think about, what does that mean for herd immunity and people who are, vaccine hesitant? Do you think that's going to help?
Population immunity is going to be difficult, I think.
Yeah.
And I think we have maybe seen that in the nursing home population as well. I think initially there was that big federal program to get everybody in the nursing homes vaccinated. Last time I talked to Jessica Callender, Rich, our nursing facility and a geriatrics expert, I think that program has stopped. So I don't know if they are still doing those vaccinations in those nursing homes on a regular basis, because we have people who are moving out of those facilities, new people who are moving in. So that is just one subset of the population. To get to the answer to your question, I think it's going to be difficult to get to that population immunity unless we have a full court press on everybody, even those vaccine hesitant people, getting vaccinated.
And to that point, when they were doing the vaccination, it was really impacting their hospitalizations, and I think that's really important. It goes back to the point of why do we have the vaccine in the first place, but that is a patient population that we are not seeing here for the reason of COVID. When Dr. Hawkinson was mentioning our critically ill patients today, they're younger. They're 22 up to I think mid-50s for those that are in the ICU status. So that push to get the vaccines in the nursing home facilities was critically important to our hospital.
To prevent symptoms from the booster shot, is it okay to take Tylenol or Ibuprofen before and after I get my second shot?
I think we have talked about this a few times, that it won't impact the efficacy of the vaccine. It is something that I know a lot of folks have been doing, and I think it's something that we've said is okay to do.
Yeah, the guidance is to not take anything beforehand, but we actually heard, Dr. Stites say he took some beforehand. And the guidance would be to just take it if you do develop symptoms, again, taking Tylenol or ibuprofen for 12 or 24 hours while you have these symptoms after that booster is not going to significantly affect your immune response, because your immune response is going to continue to develop for 1 to 2 to 3 or more weeks after the initial shot. So taking those drugs to help with those post-booster or post-dose symptoms is not going to be a problem for 12 to 24 hours. So you can go ahead and do that.
If vaccinated, will blood tests confirm antibodies?
So I think the answer to this is no, but I know you have a more detailed answer as to the mechanism of why that is. But we don't recommend going to get the test after you've been vaccinated.
I think actually that's the best point right there. There's the guidance is to not get tested for antibodies. Number one, you also have to be aware of what antibody test are you getting, because the antibody test we use here at the hospital to help confirm old or recent infection doesn't even look for antibodies to spike. It actually looks for antibodies to the N protein, which is another protein on the virus itself. So you will only have positive antibodies if you actually had the virus. You could get 2 doses of the vaccines, and that antibody test would still be negative if you've never had the actual infection. But really, the guidance is to not do antibody tests to look for confirmation afterward. In addition, if you do even test a spike, it's really unclear what the antibody is looking at on that spike. Is it even a neutralizing antibody that they're looking at? So that's another really getting into the weeds of antibody tests. But again, the guidance, just as Amanda said, is not to be looking for confirmation antibodies.
And I think it's important to differentiate antibody testing versus active infection testing. So if you've had the vaccine, you have symptoms, and you're concerned that you have COVID, we would recommend getting your, testing to see if you have active infection, which is totally different than testing to see if you have antibodies.
Yeah.
Jill, do you have some questions?
Oh my goodness, yes, we do. Jeannie wants to know, are you concerned about any of the COVID vaccines if you're allergic to sulfur?
I don't know.
Short answer, no.
As I say, I don't know what the connection between sulfur and the vaccine is.
Nope, I would still get the vaccine. You'll be fine.
Don says people with O negative blood have between 1.3 and 2.5 chance of getting COVID. He doesn't cite where he heard that or read that. Should that person get the vaccine when the percentage is about the same with the vaccine?
Anyone should get the vaccine.
Yeah, that's the quick and easiest answer. I totally agree with that. There was a lot of hubbub early about blood type and what that. Blood type is not going to protect you against getting the infection. You may have a little bit reduced chance of having severe disease or going to the ICU. But that blood type and the connection with COVID-19, the disease manifestations, is not fully elucidated. The mechanisms are not fully identified. Even if you have certain types of blood, you still have that risk of having severe disease, going to the ICU, and death. So that's the important thing to remember. So the easy answer is yes, you still need to get the vaccine.
And Elena has a question that I've seen this on the thread a few times. And it says the current vaccines do not show any sign of antibody-dependent enhancement. But is there a chance that the virus could mutate, causing antibody-dependent enhancement to the current vaccines, making the illness worse in people who have had the vaccine? So we've had people ask, can I get sicker if I have the vaccine if the mutations continue?
Yeah, ADE for short. Yeah, we never say never in medicine because we don't know. We still don't know what could happen, but I think the chances of that happening are extremely, extremely low. Can that same thing happen with influenza vaccine? Because we know that you can have antigenic drift and antigenic shift in those influenza viruses, and you're getting vaccinated the years prior. But overall, I would say that's an extremely, extremely low risk. I wouldn't say it's really anything for us to be concerned with at this point in time. There's no evidence or signal of that occurring.
Okay, and I'll do one more right now. We still have several, but I'll let you to make sure we get through the ones from earlier this week. Ross wants to know, he says, I have an appointment for the Johnson & Johnson shot tomorrow. and I cut the grass a few days ago, and I'm having severe allergic problems right now. Should I still go ahead and get the vaccine?
I would think so, yes. Really, unless you're febrile, usually allergy symptoms don't make you febrile or have a fever. So I say yes, get your vaccine tomorrow.
Yeah, absolutely. We know allergy, the mechanism of those symptoms are certainly different types of immune cells. But even, people who are ill, whether they're on antibiotics or they possibly have another common cough or cold, as long as they aren't having fever, as Amanda said, and we would wait, probably 24 hours after your fever resolves to give that vaccine. Even people who have actually bacterial viral illness are okay to go ahead and get the vaccine.
I've read doctors recommending ivermectin instead of the vaccine. I think these doctors are reputable. What do you think?
I am going to say I would recommend the vaccine.
Yeah. Really, so far, the question about ivermectin, hydroxychloroquine, zinc, all of those things have really been put to bed. There is no use, no role at this point in time based on the available data for ivermectin. I would kind of question what their sources are. But even if you just go to the NIH treatment guidelines, that question's been put to bed. I would not recommend ivermectin, hydroxychloroquine, azithromycin, or a number of different substances for either protection from the infection or the symptoms, or for treatment once you get that.
Do we know, is the Pfizer vaccine safe for young people's reproductive health?
You're going to have to correct me on this because I don't remember the age range that is specific to Pfizer versus Moderna versus Johnson & Johnson. But I know that is something that they are evaluating as they expand the age groups that are eligible to get the vaccine. Mm-hmm. So it's something that we wouldn't say is they are eligible for if it's going to have a long-term lasting effect, especially on that.
Yeah, I think, again, I thought it was either the Pfizer or Moderna has 16 and above. Either way, I was actually looking on the ACOG, which is one of the societies, the medical societies for obstetrics, this past week. And their statement is, concerns or information about infertility or sterility are completely bogus, and that has been vetted out by science as not being true. That was a misinformation campaign. There was no science to back up those claims of infertility or problems with reproductive health. If you have further questions, I would certainly recommend you talking to your OB-GYN about that. But that is a statement clear on the ACOG website. So.
Okay, can you only have one dose if you had side effects with the first? If we're 80% protected with one shot, why do I need the second?
No.
So for those multi or the 2-dose vaccines, I think what we know from the studies that they performed is that they are mostly effective if you get the full dosages, both doses. So my recommendation would be, again, to get both. We do know that one is probably better than none, but I would sure recommend getting that second dose if 2 are recommended.
Yeah, we're going to recommend getting that second dose. Again, side effects. I never had smallpox vaccine, but from what I understand, people that got smallpox vaccine had a pretty significant local reaction in their arm. They had scabbing, they had swelling, pain, bleeding. We don't have that with this. We know that with other common vaccines, such as the shingles vaccine or the human papillomavirus, the HPV vaccine, which every child should be getting at this point in time. We know that you can have symptoms and side effects from that, but those are transient, and those are never going to be as bad as getting the disease or the risk of getting the disease. So, yes, please, if you got 1 dose and it's scheduled for a 2-dose series, go ahead and get your second dose.
Is it safe for me to do home health with active COVID patients if I am fully vaccinated?
This is something we've been taking care of active COVID patients in the hospital since March of last year, and we've been doing it safely. We've had no known transmission of a COVID positive patient to an employee because we've put into place the infection prevention measures, good personal protective equipment, good hand hygiene, staying home if you're sick so you don't get the patient sick. So I think it absolutely is safe. I think you're safer with the vaccination, but we wouldn't change any of the infection prevention practices. So really the critical piece there is the personal protective equipment, a good mask, and wearing your gown and universal eye protection.
Yeah. Yeah, no, absolutely. We have our brave therapists, occupational therapists, speech therapists, physical therapists who have been working with our COVID patients since the pandemic began, prior to any vaccination, and just doing those pure infection prevention guidance techniques of wearing mask and eye protection, as you said, especially will keep you protected.
Okay, so we booked a trip to Hawaii for September. Now the state says we have to provide a negative COVID-19 test 72 hours before arriving or quarantine for 10 days. Is this going to become a thing in all states?
We've seen this in various states and international travel, local travel, where the negative test is required. I anticipate that this will probably stay in place for the duration of the pandemic. So I think that is probably just kind of what we're going to have to get used to for short term, at least.
I don't know if it's going to be something in the contiguous states. I don't know if that happens for Alaska. But, just as you said, international sites, certainly Hawaii is its own unique state there. So it really is hard to say. They are trying to do everything they can to protect their state and their cases. So it may go away. I don't know. I think that's one more reason why we need to continue to promote vaccination for everybody to be able to do that. But, right now, for a long time, Hawaii was just shut down to travelers as well. So I think this is one more step to continuing to be open to allow people to go there and travel there.
Are the CDC guidelines for daycare centers, are there any for the new variants?
So I think the important piece of anything that we learn about the variants is that the prevention measures stay the same regardless of the variant. We know it's the social distancing, the wearing the mask. Those are the critical factors for prevention regardless of the variant. So if you look at the CDC guidelines for school-aged and daycares, they are pretty consistent with what they were previously, despite the growing volume of variants in the population. So the prevention mechanisms have not changed.
Nothing's changing. Anything to add?
I think that was great.
All right. Okay. Do you know of anyone who is fully protected 2 weeks past their second shot who has tested positive for COVID-19?
Yes. We have had employees, so that's kind of the population that I'm pulling from, who have tested positive after well beyond their second dose. I think the critical piece of information here is we know that you can still transmit the virus or get the virus, but the severity of the illness has been, we haven't seen anyone with significant symptoms, especially not requiring hospitalization. And it's been a couple of weeks since I've looked into this. But when I looked previously, our patients, if there was documented, which it's extremely hard to find that documentation of vaccine unless they have the vaccine here, we haven't seen that in our hospitalized patients, which was the intention of the vaccine.
Yeah, no, I think that's a good point. That draws us back to one of our first questions. This is why vaccines work. And what it does is you can still get exposed to the vaccine by somebody who is ill, whether they know it or not. You can still get the infection, but your chance of getting really any of those, that spectrum of disease, whether it's mild symptoms or certainly more moderate, severe, critical illness, disease is going to be significantly reduced. So just testing positive is not unknown, and we know and expect that, because people are still going to be exposed. But your chance of having symptomatic illness goes down. Your chance of having to go to the hospital, of having to go to the ICU and dying, significantly is decreased from the vaccinations. It's not going to fully protect you from infection, but all of that other wide spectrum of disease, you are going to be significantly protected against.
Jill, we have time for a few more questions. What do you got?
Oh my gosh. Lots and lots and lots. You're rocking through them and they like it. I want to acknowledge Brian. I think that the question you asked about Missouri's COVID rates, we have an expert on Monday, so I'm going to save that one. Emily wants to know, have you seen the UK report finding that those who have had COVID have as much immunity after as those that have the first vaccine?
Yeah, I would disagree with that. That's not true, actually. There's a number of studies now. I was looking at one from Israel because they have an excellent real-world experience now with vaccinations in their general population, but also their healthcare workers. What it shows actually is after the vaccines, especially after that second dose, your ability to detect neutralizing antibodies is significantly higher compared to people that have had natural infection. And that is why, again, we continue to promote vaccination, because your level of immunity, although we don't know the full correlate of protection from those antibody levels, from what we can detect in those antibody levels, they are significantly higher in people who've gotten vaccinated versus people who have just had COVID infection. And this includes especially mild disease where you have barely no symptoms at all. So, I would certainly disagree with that statement. We have seen that vaccination offers probably more protection than does natural infection itself.
Sue is asking, we are hearing that the RNA vaccines are effective for at least 6 months. What do we do at the 6-month point?
Mm-hmm. Yeah, I think most of us expect the vaccines to be effective for more than 6 months. We just have good now data and data analysis to show that they are. I still am going to anticipate more to that 12-month period. And even at that point, we don't know, because vaccines really haven't been around that long, but that will continue to be evaluated. I think what's more concerning is would we need a booster, taking into account certain variants, and especially I think the South African or B.1.351 variant seems to be more of a concern when you're talking about cross-reactivity or cross-immunity from some of these other variants. So I think more than how long does that immunity last from these mRNA vaccines, it's going to be, can we enhance your immunity or specialize it even more for further protection against some of these variants, including that South African variant.
And Glenn is asking as a follow-up question to that, is that the same for the J&J or just the RNA version?
I think it would be the same for all of the vaccines, and to your point, fully expecting that this will become a booster moving forward. Yeah,
the problem is with the J&J, we just don't have enough of that data because it just hasn't been around as long. But certainly, we'll be looking for any data and published studies as soon as they're out.
Melissa says that her brother is traveling across the country visiting family members in June. She says, we are all vaccinated, but they're hesitant about vaccination, so they may not be. Is it too risky even to get together, as we are visiting several households over the trip? Or is it okay if we just all mask?
So I think that's really the key piece. If you are intermingling folks who are vaccinated and unvaccinated and they're coming from multiple homes, those infection prevention practices are still really important. So I would mask to the best of your ability, and I would continue to maintain social distancing. If anyone is showing symptoms of any kind of illness, maybe don't interact with them or have them stay home. But really, unless you're with a group of fully vaccinated people, and again, in a smaller group, masking would still be recommended.
Yeah. I would still continue to talk with them or have them talk with trusted sources because, again, on a daily basis, there's more information about the positive effects against the vaccines. Even though some of the immunity is reduced against these variants, and especially we know now that that UK variant, the B.1.1.7, is becoming a higher proportion, becoming more prevalent in the United States, we are seeing that vaccination is helping even against those variants and giving protection against those variants. So the quickest way that we as a community or a society or a country is able to get back to more normalcy is going to be through vaccination. So please just encourage any of those vaccine hesitant people to talk with trusted sources. Make sure those sources have the correct information, but that is the way that we can then meet with family and friends more like you want to do. So I would continue to encourage vaccination.
Just a couple of more questions. And Matt, I love yours, but I want to give a chance to let the doctor see it. So maybe Monday or Tuesday we'll talk on this.
Ooh, controversy.
Susan wants to know, is there any place that someone with a blood cancer can find out if the vaccine is working? She's read that they only respond usually 13 to 36%.
Yeah, that's a good question. So first of all, there really isn't guidance, and we have said that the guidance the recommendation is to not check antibodies. we know that immunity is not only antibodies, it's also responses from another immune cell called T cell or T cell responses. Right now, there's really no accessible, real good commercial T cell antibody, T cell assay to look for immune response to that. But I would venture to say you are probably getting other vaccinations like influenza vaccine, like tetanus vaccination when it's time, or the pneumonia vaccination. I would still go ahead and get those vaccines because there is continued more chance of benefit than there is risk to your health itself. And again, these are significant questions that you have to talk about because the details we don't all know about for your specific case. So please talk about that with your hematologist.
Okay, and last question goes to Joe. Any information on vaccines and tinnitus?
Well,
No.
I guess I would want to elaborate on the question. Are we?
Yeah, I mean, again,
And this could be too, I don't know, but
Yeah.
there was a big article about the owner of Texas Roadhouse, and he was a long hauler. And I think tinnitus was one of the complaints that he had.
I know, and I talked to one of our ENT physicians not too long ago about this, but there hadn't been anything officially published or indicating that there would be a significant interaction there where the vaccine is causing those symptoms. And I know that's been raised before, but I haven't seen anything in regards to. And maybe the question is, does it cause tinnitus or what? I'm kind of struggling with what connection we're speaking to. But I know I had a conversation with Dr. Sale, and he had referred to his professional organization, and there was not a formal stance on the impact there. So I that's kind of an incomplete
good
answer.
And Dr. Sale is one of our ENT experts. So.
All right, Jill, thank you. All
But
right, so-
Marie, let me just do one more because Marie
You go
just
for
put
it.
this in, and it's a good one. And I promise this is the final. Marie wants to know what is considered moderate versus severe infection. I think that's a good. We talk about that, but medically speaking, what would you say?
Yeah, and I think those definitions, I have to go back and look at those definitions, but I believe moderate is changes on imaging, a respiratory rate that I think is above 30, and also an oxygenation level in your body or your blood oxygen level of under 94% or under 93%. But there are definitions there at the NIH website, and I think even on the CDC website. But that is what we are basing mild to moderate to severe on. And certainly when you have severe, you're having increased oxygen needs, increased respiratory rate, things of that nature. So that is kind of how we say mild, moderate, and severe or critical.
All right, Jill, thanks. Save those questions. We'll get to them next week for sure. Okay, so coming up Monday, we're going to hear from the health department leaders in Jackson, Johnson, and Shawnee counties. So we are going to be joined by Bridget Schaefer, Sammy Areola, and also Derek Furlog. They're going to update us on vaccination and infection rates in their counties. Plus, they're going to weigh in on the variants popping up around and some of their biggest challenges getting people to get the shot. So speaking of getting the shot, here at the health system, we have thousands of appointments that are open, and we need to get them filled. So we're doing clinics throughout the weekend. If you live in Kansas, you are eligible. If you live elsewhere, but you work in Johnson County, you are also eligible. There are 3 ways to make an appointment. Here they are. Patients can request a shot by using MyChart. And if you're not a patient, you can go to kansashealthsystem.com/vaccine, or you can call us at 913-588-1227. There's the information right there on your screen. We need to reach 80% vaccinations to achieve that magic number, the herd immunity. So we're not there yet. So please get your shot and help us spread the word. So on that note, Amanda, final thoughts from you.
I think today is a big day. You were mentioning about Kansas, but I believe today is the day for Missouri as well, April 9th being a big day for opening up vaccines. So I think that over the weekend, get your vaccine if you haven't.
What are your thoughts?
Again, I think daily there is new published articles, and if you have a chance to go to the NIH website or the New England Journal of Medicine website, you can see those. And it continues to show us and signal that the way out of this pandemic to be able to get to the K, to Arrowhead, to Children's Mercy Park, to do those things that we want to do is through vaccination. These vaccinations are very safe, and they are very effective at helping prevent those more significant things about disease that we talk about, and that's hospitalization and death. So please, everybody, now you have the chance. Please go out and get vaccinated.
Thank you both for doing all the work today.
Thanks.
I just sat
Yeah.
here. You guys have great answers. Thanks. All right, and thank you all. Yeah, they were. Thank you all for tuning in today. So as we close out, we had a great tip from one of our viewers, Rusty, who was watching us last week. He suggested that we show everyone the beautiful tulip beds that are here in and around the health system and the medical school on the campus. And we thought, yeah, why not? This is gorgeous. So enjoy. We're going to see you back here again on Monday. Stay safe. Have a great weekend. Get your vaccine.